you how the nanosensor can be used for our point of care, healthcare system. And so I'll give a general talk, and if there is any questions, we can also discuss that during the lunchtime or something like that. Okay. And also I have so many different positions, but right now I'm at Pennsylvania State University, but also connected with the University of Arkansas and also with the neurosurgery department. So I do a lot of surgery, and I will show you. My talk will be involving some patient surgery, but I may not be able to cover everything in 30 minutes. So I'm not trying to sell this book, but this will be a kind of 15 books I wrote. One of them will be a nanomedicine book, and this will give you most of the information what I'm giving the talk today, and also the mobile wearable technology. Could be a bra, or could be a shirt, could be a socks kind of thing, which can also go through a cell phone, go to Wi-Fi or the cloud. So I'm going to address to neurologic disorder, that's my specialty, using the engineering, but particularly sleep disorder, sleep apnea, and traumatic brain injury, particularly American football players, because they go through the concussion many times, and so that's one of the things. And my specialty when I was doing my medical degree was Parkinson's disease, and that would be to implant a device in the brain and how to control your movement disorder. Then seizure and epilepsy came out from there also, and I will explain that to you. And then the same kind of thing which should be able to address that to autism spectrum disorder, and which is very typical for the many children. And cardiac disorder and the diseases, heart attack, for example, everybody aware of that, but how we are going to predict that far in advance, and heart rhythm and arrhythmia, and this work is all funded by Boston Scientific, which Richard mentioned also, and we are interested in the congestive heart failure and so on. And then also pericardial effusion, which I call the dancing heart. Your heart and my heart, everybody's heart always dancing in the three-dimensional sense. Even when you're sitting there, excited and everything will be different kind of thing. And sudden cardiac death. Now there is a relation between the heart and the brain, and which we call the neurocardiology, which is a new topic coming out for the past 10 years. And I will show you some of these things, what we are doing. Now, in the global cyber healthcare, of course, involves nanotechnology and also biotechnology and information technology. And we could be applying that to either through GSM, which is a very typical thing in the US, and many other countries, they are trying to get the GSM, because GSM, you may not need the cell phone. So you can go through AT&T GSM and then get the information for the patients. And but I'm going to show you some of the patient data later on, using the cell phone and others. We are also looking at the healthcare system, the neuroscience and drug delivery, and also spinal cord injury, and also brain injury, and also for any kind of athletes. Only thing I may not be able to cover everything 30 minutes, but if we can, if you need something, please stop and talk to me in the lunchtime. So we are doing the global diagnostic and therapeutics. What we are now looking at, not only nanotechnology, we need to have the organic electronics, which is a printable electronics, which will be very flexible, which will be part of the clothing, and part of the bra, part of the shirt, and so on. And that will be given to the diagnostic and therapeutics, and that's where the engineering and medicine comes in play. That's where multidisciplinary system. So here this can be done by the point of care, will be bedside testing, self-testing, telemedicine, ambulance services. All these things are used in the wireless signal processing and internet. And the point of care receiving station is there in Penn State. And the database will be collected, and we also have a research hospital in many countries, including Abu Dhabi here, as well as in India and other places. and then we do the treatment decision based upon the database and decide whether we need to save the fellow's life or improve the quality of life.